Nelson. Today I'm going to teach you how to take your blood pressure as well as inform you about the consequences of having high blood pressure. Did you know that the #1 cause of death is heart disease due to high blood pressure? Many people don't realize that having high blood pressure can have severe consequences as death and health risk. Blood pressure is one of the main vital signs that health professionals take when they are seeing a patient for the first time because of the large effects it has on patients and in their health. I have done much research on this topic throughout my college education while preparing to become a nurse, as well as my CNA courses. We were taught how to take blood pressure, as well as the consequences it can have when your numbers are high. I am also currently at my job as a child care partner, or a CNA. I take blood pressure on all my patients when they first enter the facility. Today, I'm going to take the opportunity to tell you the consequences of high blood pressure can have on one's health, as well as teach you how to take your own blood pressure so you can prevent yourself from having high blood pressure. Blood pressure can cause serious issues for one's health. About 1 out of 3 people have high blood pressure, which is around 33.1% of adults. There are many health concerns when it comes to having high blood pressure. High blood pressure can result in death, as I stated earlier, as well as serious health risks. High blood pressure has one of many following consequences. You can have heart disease, kidney disease, congestive heart failure, as well as stroke. Currently, having heart disease is the #1 cause of death, with #3 leading is stroke. These are very severe with having high blood pressure. If one detects that they have high blood pressure, there are many ways to prevent it, either through medication, increasing your physical activity, seeing what your past family history is, as well as watching the intake of your liquids and of your dietary supplements. When determining if one has high blood pressure, it all depends on a couple of circumstances. First is age. The older the person is, the more likely you are to have high blood pressure. Ethnicity. This can be a factor regarding past family history, and many African Americans develop high blood pressure more than Caucasian people in the United States, and this is as of 2009. Gender, many people think, oh, men have higher blood pressure, but really men only have high blood pressure in their younger ages, and women receive higher blood pressure after menopause because their bodies are readjusting and don't know how to adjust to the new blood circulation that's going through their body. Physical activity. If you increase your physical activity, you have a better chance of lowering your heart risk of low blood pressure, but that doesn't mean that having physically active every day will decrease it. Many people today who are very athletic or runners, run a lot of triathlons, they actually have higher blood pressure than people who don't exercise. So it all depends on the person themselves. Food intake is very important. You always hear, hey, don't put that much salt on your eggs, or don't put that much salt on your potatoes, because salt can have a very big effect on your high blood pressure. The 2 biggest factors are alcohol consumption and the salt can affect high blood pressure. However, on the opposite side, having high levels of potassium, folic acid, and excessive amounts of caffeine can help prevent blood pressure. Now, if you're one who only drinks caffeine for a little bit on a regular basis, that actually can have a bigger effect on you. So, be careful to it's better for you to drink a lot of caffeine so it decreases the amounts of blood pressure. Now that we've learned about the consequences blood pressure has, I would like to have one of you come up here so I can teach you guys how to take your blood pressure. There are 2 things that you need. The first thing is a stethoscope. This will help you measure the pulse that's going against the main artery in the wall of your arm. And this, here, I will have you hold this for now. The next thing is the blood pressure cuff, and it's also known as a sphygmometer. And there's many ways you can do this. You're also able to go to your local pharmacy to have it done, but if you're able to do it at home, it's not that hard. It takes some practice. So the first thing you'll do is you'll take we have your right arm. Actually, sorry, left. You'll slide it up. You're going to use the fastener of the Velcro to fasten the arm. The arrow. As you're going to tighten it as fast or tight as you can. And there's usually 2 arrows right here that demonstrate where the artery is located, if it's either on the left arm or the right arm. Now you'll place the stethoscope in your ears. first thing you will do is you will pump the gauge up to around 150 to 180, depending on the size of the person. So pump it up, and you want to tighten the valve first. Once I reach it, I will put the diaphragm of the stethoscope on her brachial artery and wait for a pulse. You will begin to loosen the valve as you start hearing the heartbeat of the pulse go down. Once you hear the last pump of the blood, that is when it is the diastolic number. So the first number you hear is the systolic number, and that it will be your number, and it should be the highest number you will reach. And then when you stop hearing a pulse, that will be the lowest number, which is your diastolic number. Now remember that, Now remember when you're taking blood pressure, it all depends on the size of the person. If you have a heavier, overweight person, then you're going to pump it higher, and they're going to have a higher systolic number as well as a higher diastolic number. Any top number reading between 105 to 135 is usually considered like good range for a healthy adult. And then with the bottom number reading between around 60 to 85. So the ideal range is having someone rank between like a 120 over 65 would be the ideal range. So thank you for your help.
You're welcome.
Now that you've learned how to take your blood pressure, I want you to go out and help prevent other people from having high blood pressure, because this can have serious consequences on yourself as well as others. Knowing how to take your blood pressure, you should be able to prevent high blood pressure because it becomes an issue. Like I said, you could have heart disease, stroke, kidney disease, which are all the main leading causes of death currently in the U.S. for adults. It can be very difficult to do it for yourself, so like I said, go ahead and go to your local pharmacy, or even see your pharmacist. They're willing to do it for free by themselves. Just go in and say you'd like a healthy checkup, and they're willing to do it. Remember, controlling the intake of your physical activity, your food intake will help you prepare yourself to have a lower blood pressure. Thank you.
Yay.